we need to really critically agree on how we'll move forward on various things. On health, which is one of my primarily, or my top agendas of this county. Education, mapping of the hospitals, very important. The challenge we have had in hospitals is, yes, we know that we don't have enough doctors, nurses. We have opened more facilities than, and we don't have the human resource. We are working on that. In July, we'll be, between now and the next 1 month or so, we're employing another 87, but that's a drop in the ocean. But in July, we're employing another 340 to the hospitals. I know it will not be enough, but if you see already some of our dispensaries, I don't know if the team who went out, if they got these stories, where there are some askaris even inject patients in some dispensaries in the remote areas. It's very dangerous. So that is a challenge, which is a big challenge. I am really interested to see, I've been talking with already some donors on facilitating on, you say the data desk, but I want to even move it a step higher and go to a call center. Yeah? When you talk of the issues, the lady, what is her name again? Dr. Shiro, talked about on the women. Yeah? If you had a call center where you have medics, yeah, who can answer some of these questions to these women, it will help a lot, apart from the outreach with the PP, community health promoters. So a data desk, very important. That one I need it like yesterday. After all this information, you have no choice. You need that because that's how you can be able to work more efficiently. But a call center, I think, is also important to deal with those issues.
The thing that we think that you need to do at this particular point with regard to health especially is that there's a gap, and the real gap that is there is a gap of data. In a lot of those situations, we are finding that there's not enough data for us to make strong cases. If you're talking about the question of, for example, the mothers, teenage mothers, HIV prevalence and so on, you're finding that there are many places, especially when we were collecting this data and we were collecting it in the most rural parts of Kilifi, you're finding that there are places that even awareness of the kind of data that would be there was low. And so we think that there needs to be a real initiative to deal with this systemic problem. You can see that the systemic problem is doctors to patient ratio, HIV under 15, ANC, immunization, malnutrition. You can clearly see out of the data that 25% of kids are unsupported. When we were looking at the data back there was a full 1,000 children per month that were not covered in between ANC visits and immunization. There's a gap of 1,000. 1,000 children per month is huge, considering that as a county, we do want our kids to be healthy and to grow well. So this is the initiative that we feel is a primary initiative for the county. We have to fill the data gaps. As the Open Institute, we're committing ourselves. This is one area that we know we can help with. And so we are here to offer ourselves to you and say, if you would like us to work with this with you, we have worked with several other counties to build something called a data desk. And essentially what a data desk is that it's one that involves all of your departments and makes sure that all data from all of the departments is collected and brought into one place so that then you can be able to make decisions. In Nandi County, for example, where we have worked, and it was our number 2 county to work on the data desk, it is possible for the CEC or for the governor to actually, from their phone, go through their data, even yesterday's data. What was revenues yesterday, how many people went to hospital yesterday, and so on and so forth, right from the phone, without necessarily leaving the house. In fact, without necessarily leaving bed. They will already have that information.